right. Okay, so a very good afternoon to everyone, and I welcome you all to this particular session. So now what is that I will be discussing in this session is, so before that, let me introduce myself. I am myself Dr. Rajesh Gubba. I am the General Medicine Educator on Arise Medical Academy. So in this session, I will be discussing some new updates related to your COVID-19. Right? So COVID-19, as the pandemic is still going on, every day the data is getting updated. Right? So in this particular session, I will be giving you the update related to the treatment part. And not only related to the treatment part, mainly from the medicine point of view, the update what I wanted to give you is, right, many of us are under the impression that COVID-19 means the pulmonary manifestations. Let me tell you, COVID-19 means it is not just only pulmonary manifestations. In COVID-19, you also have many extra pulmonary manifestations as well. So that is what is the update what I wanted to give you. Now, what are those extra pulmonary manifestations? All that let me discuss in this particular session. And apart from that, the other important update what I will be giving you is, what are the new drugs which we have in the market now for the treatment of COVID-19? And what are the drugs which are in the pipeline, right? What are the drugs which are in the pipeline for the treatment of COVID-19? Even that particular update also I will give you. Then followed by that, and as every one of us know, that vaccines have been released into the market by the Pfizer company and as well as Moderna. So I will be also telling you about the vaccines related to your COVID-19. So what is the dosage of that particular vaccine? What is the route of administration of the vaccines? What are the contraindications for vaccines, right? And how many dosages of that particular vaccine should be taken? And what is the efficacy of that particular vaccine? So all these updates I will be giving you in this particular session. All right. Now just hold on completely to me, right? I will not discuss MCQ type of pattern of discussion. I will mainly tell you, like, these are the points which you have to remember for your exams. That is what I will be giving you the update. Okay, right. So first and foremost, the very important is, right, now first I will tell you about the pathogenesis, right? See, everyone is aware how is the transmission, right? How is the transmission? The transmission, one second. Yeah. So if you take the transmission, it is through the droplets. The transmission is through the droplets, or the transmission might be through the contact. And that particular contacted hand, if it is touching your eyes, nose, or mouth, then also the COVID-19 can be spread. Now, regarding the immune response, let me tell you one of the very, very important update. See, until now, many of us might felt the symptoms of COVID-19, but how many of us might have got tested, right? Very few may not have got tested also, right? Thinking that TK, it will just go on like that, right? But why? And thinking that it will just go on, and for some individuals, it also went on. The individual did not have very serious effect of that particular COVID-19. But some of the individuals, once they developed the symptoms, they had very florid manifestations. Now, why is the difference? So remember, once the COVID-19 enters into the individual, it also depends upon what is the virus titer, what is the virus load in the individual. So is it a low virus load, or is it the high virus load, right? Is it low virus load, or is it high virus load? Like, for example, if the individual is having low virus load, then most of these patients, they don't require hospitalization, right? And just with supportive therapy, antipyretics, and as well as the proper steam inhalation and antibiotics, the COVID was completely got treated if it is a low virus load. But the entire problem has come whenever the individual is having high virus load, right? Whenever the individual was having high virus load, that is the point when the individual was requiring the hospitalization. The individual was requiring the oxygen supplementation. Now, what will happen? What is the pathogenesis? why there was requirement of hospitalization, why there was requirement of the oxygen inhalation and all, why there was requirement of the mechanical intubation and all. Let me tell you. Now the point is that whenever there is a high virus load, now to this particular virus, immediately the policeman of our body has come to that particular virus. That is monocyte and as well as macrophages have come to the virus. Okay, now the virus will tell, like the policeman will come and tell, who are you who have come into my body? Right now, this virus will try to fight with this particular policeman. So, what the policeman will do in the process of fighting with this COVID-19 virus, the policeman of our body, that is macrophage and monocytes, that is monocytes macrophage system, they will release the inflammatory mediators, right? They will release the inflammatory mediators. And what are those inflammatory mediators? They are these particular inflammatory mediators. That is cytokines, which includes interleukin 6, interleukin 10, and as well as tumor necrosis factor, TNF. Now, what did our policeman do? Our policeman has done the release of the bullets, right? The release of the substances to kill the COVID-19. But what has happened in the process? Now this COVID-19, it also started fighting with these particular cytokines. And in between, what has happened? The organs got affected. In between, the organs, they got affected. So there was lung injury, there was development of septic shock, organ failure, and there was also development of the coagulopathy. So this was the problem. What has happened? Once there was monocyte macrophage activation. So in nutshell of this entire slide is that if there is low virus titer, if the immunity of the individual is good, then normal immune response was there and the individual had a good recovery. But if there was a high virus load, in response to that high virus load, there was excessive release of the cytokine storm that includes interleukin 6, interleukin 10, and TNF. This interleukin 6, interleukin 10, and as well as TNF, that damaged our organs, lung damage, gone into the stage of ARDS, requiring ventilator, right? The other organs also got affected, that lead to multi-organ failure. And these individuals, they also have coagulopathy. Now, what is the reason for the coagulopathy? I will explain you in detail, right? We have a beautiful mechanism why there will be coagulopathy in patients with the COVID-19. Because if you take these COVID-19 patients, let me tell you, they are not just presenting with the pulmonary manifestations in the form of cough and dyspnea, right? We have seen certain patients presented with transient ischemic attack. We have seen certain patients presenting with heart failure. We have seen some patients presenting with coronary artery disease, and we have also seen some patients presenting with renal failure. So in COVID-19, it is not just only pulmonary manifestations you will have. You will also have multi-organ involvement, right? Multi-organ involvement. Now, why is this particular multi-organ involvement? That is because of the presence of ACE2 receptors in the various organs of our body. So the point is that what is the receptor for COVID-19? That is ACE2 receptor. For example, this is your ACE2 receptor. On this ACE2 receptor, the COVID-19 will bind and it will enter into the cell, right? And it will enter into the cell. So the point that you should understand is where the organs are having more ACE2 receptors, more will be the invasion of this particular COVID-19. That is one important update that you need to know. Next, and everyone is aware that children, they are less prone for COVID-19. Many of us know this, right? Now the question is why? Right now the question is why? Why children are less prone for this particular COVID-19? See, in children, the immunity is not full-fledged form, but whereas in elderly individual, the immunity is less. That is why the risk of COVID-19 infection and as well as morbidity and mortality is very high in elderly individual. Sir, but even in children also, the immunity is not good. It is not fully developed, but still, why? The incidence of the COVID-19 is not very high in children. Why? Because the concept is very simple. What is the receptor which is required for the entry of this particular COVID-19? It is your ACE2 receptors, right? It is your ACE2 receptors. It is through ACE2 receptors, the organism will enter into the cell. Now, in children, one second. Okay, sorry. So why in case of children the incidence of COVID-19 is less? The reason is that the number of ACE2 receptors, right? The number of ACE2 receptors in children is less. And that is the reason why the entry of the organism is not that easy like what the entry of the organism occur in elderly individual. And that is the reason why even though the immunity is less in children, because the number of ACE2 receptors are very few in number, the incidence of COVID-19 is less in case of children. Okay, so this particular slide is completely related to your cytokine storm. And what are those cytokines? Interleukin 6, interleukin 10, TNF. They are the one which will cause damage to the multiple organs, including the lung, right? Including the lung. All right, next. Now, followed by that, let me just give you another important update. So this was the slide related to the pathogenesis. Now another common question which has been asked in the OPDs for us is, if the individual is asymptomatic, can he transmit COVID-19? That is another important question, very, very important question. Let me tell you, there was a study in multiple places all over the world, and there was a meta-analysis done on this particular multiple studies, whichever has been done all over the world. Now, finally, what they have concluded is, even though the individual is asymptomatic with COVID-19 infection, still he has the chance of transmission, but the chance of transmission is only 6 to 41%. Right? The chance of transmission is only 6 to 41%. That is, if the individual is also asymptomatic, still he can transmit. That is, but the chance is only 6 to 41%. That is another important multiple choice question that you need to be completely aware of. Now, followed by that, what are the agents which are required for inactivation, right? See, at multiple places, we might be having that particular hand washes, right? And we might be using that particular hand washes in our pockets also. Now, what should be the agent that should be there in your hand wash to inactivate the organism? That is an important multiple choice question in your upcoming exams. Let me tell you, the hand wash, whatever you are using, should contain 62 to 71% ethanol, either this, or there should be 0.15% hydrogen peroxide, right? Or there should be 0.1% sodium hypochlorite. Okay, these are the agents, these are the substances which will inactivate this particular COVID-19, right? These are the substances which will inactivate the COVID-19. Okay, so 62% to 71% ethanol, 0.5% hydrogen peroxide, 0.1% sodium hypochlorite. These three are the substances which will inactivate the COVID-19. Now, apart from this, let me tell you, these agents, they are less effective, right? These agents, they are less effective. Like benzalkonium chloride, less effective. Chlorhexidine digluconate, that is also less effective. Right, benzalkonium chloride and as well as chlorhexidine digluconate, it is less effective. Okay, so these are the agents for inactivation. These are the agents for inactivation. Okay, this is an area of multiple choice question. What is the agents which are required for inactivation? That includes 62% to 71% ethanol, 0.5% hydrogen peroxide, 0.1% sodium hypochlorite. Only these agents can inactivate the organism. All right. Now, after that, let me discuss the other important area of the recent update. Right. So we should appreciate one important country where it has completely eliminated that COVID-19. And what is that particular country which has eliminated the COVID-19? That is New Zealand. Right. So New Zealand is the country which has completely eliminated this particular COVID-19. So in February 26, there was a first case of COVID-19 in New Zealand. Right. There was a first case of COVID-19 in February 26. Right. And after that, in the present day, if you see the status, you have some travelers which have gone to New Zealand where they are kept under quarantine. But as such, in New Zealand, this particular COVID-19 is being completely eliminated. So this is one of the very appreciating thing related to this particular country of the New Zealand. Right? Next. Then followed by that, I will just directly go on to the treatment part. Okay, what are the new updates which we got in the treatment? Okay, so before going into the treatment, let me just give you a small update related to the investigations, and then I will move on to the treatment and as well as extrapulmonary manifestations. Now, every one of us are aware of, right? So what are the investigations? RT-PCR, antibodies, and CT scan. These are the things. Everyone is aware of this. But if the question is asked, what is the hallmark feature of the CT chest in patients with the COVID-19? The hallmark features of the CT chest in patients with COVID-19, it includes the peripheral ground glass opacities and the consolidation of the lungs. Right? Peripheral ground glass opacities and as well as the consolidation of the lung. So these are the hallmark features in the CT scan of a patient with the COVID-19. Now, apart from this, right, so you have what is called the CORAD scoring, right? You have what is called CORAD scoring. So we stage this particular CT scan finding into CORAD 1, 2, 3, 4, 5, 6, right? Let me tell you, this is a very important area for questions to you in COVID-19. CORAD 1, these individuals, they're having normal CT scan. And there are some non-infectious abnormality within the CT scan. And you take CORAD 2. In case of CORAD 2, there is low level of suspicion. Okay. And abnormalities, they are consistent with infection other than COVID-19. There is some abnormality in the CT scan, but that means there is some infection which can be found out within the CT scan, but it is other than COVID-19. Right? It is other than COVID-19. All right. Next. Then we have the CORAD 3. What is CORAD 3? It is doubtful. It is unclear whether COVID-19 is present or absent. It is unclear whether COVID-19 is present or absent. That is what is your CORAD 3. And whereas CORAD 4, it is high level of suspicion. Right? CORAD 4, it is high level of suspicion. That means the abnormalities suspicious for COVID-19. Right? Abnormalities suspicious for COVID-19. That is your CORAD 4. And whereas CORAD 5, it is typical COVID-19 features. And CORAD 6, it is PCR being positive. RT-PCR is being positive. So this is about your CORAD scoring related to your COVID-19. Okay. CORAD 1, normal. CORAD 2, infection is there, but it is other than COVID-19. CORAD 3, unclear whether it is COVID-19 is present or absent. CORAD 4, suspicious for COVID-19. CORAD 5, typical COVID-19 features. CORAD 6, RT-PCR itself is positive. You need not require CT scan again. The purpose of doing CT scan is to make out whether the COVID-19 infection is present or absent. That is the purpose of doing this particular CT scan. All right. So this is a very important point. Please remember that. Next, followed by that, the next important thing is, see, I said you the typical COVID-19 features are there in the CT scan. Now, immediately you may get a question, sir, what do you mean by that word typical COVID-19 features on the CT scan? In early stages of COVID-19, that is during the 0 to 4 days of acquiring the COVID-19, the individual will have ground glass opacities, partial crazy paving. Whereas in progressive stage, that is around 5 to 8 days. Around 5 to 8 days, the ground glass opacities which were there in the early stage, there will be extension of this particular ground glass opacities. Right? There will be extension of this ground glass opacities. And in the peak stage, that is around 10 to 13 days. That is around 10 to 13 days, there will be complete consolidation. That will be complete consolidation. And after 14 days, right? After 14 days, there will be a gradual resolution. Right? After 14 days, there will be gradual resolution. So these are the CT changes over time. Early stage, ground glass opacities. Progressive stage, extension of ground glass opacities. Peak stage, consolidation. More than 14 days, once the individual is becoming normal, there will be a gradual resolution. So these are the CT scan changes in case of the COVID-19. And you also need to remember the CORAD scoring. CORAD 1, 2, 3, 4, 5, 6. Right? Next. Now, I'll just check very quickly whether you people are following or not. Tell me what is CORAD 6? Yes, any one of you? What is CORAD 6? Yes, if anyone can tell me what is CORAD 6, I'll be very happy and then move to further part of the discussion. None of you? Right. So the CORAD 6 is RT-PCR being positive. CORAD 6 is RT-PCR being positive. Okay, right. Now we will move on to the next investigation. Very good, Jay Surya, right? Very much appreciated. Right. Now you take the other investigations apart from your CT scan and apart from your RT-PCR and all. Let me tell you, the COVID RNA, right? The COVID nuclear material, right? The COVID nuclear material can be isolated even from the stools. Right? The COVID nuclear material can be isolated even from the stools. You understand? That is about the investigations in case of the COVID-19. But if the question is asked, sir, what is the investigation of choice? The investigation of choice, without any doubt, it is RT-PCR. Right? The investigation of choice, without any doubt, it is RT-PCR. Now, majority of the patients will be asking one common question. Sir, now I am asymptomatic, but okay, my family member had a COVID positive, but I am asymptomatic. So if I test RT-PCR, do you think that I may be positive? Right? Let me tell you, even though the individual is asymptomatic, but if the individual has acquired the infection, then even though asymptomatic, the PCR can be positive. Right? The PCR can be positive. Okay. So how many days before the asymptomatic phase, the PCR can be positive? The PCR can be positive even 1 week before also. 1 week before the development of symptoms, almost like 10 days before the development of symptoms. If the individual has acquired the infection, the RT-PCR can be positive. Right? RT-PCR can be positive. Okay? Right. And the next important thing, see, and many of the doctors or many of the healthcare personnels, we might have had some symptoms, right? We might have had some symptoms, but we didn't got tested and that symptoms completely washed away. But now I have a doubt that symptoms what I had last month, I had some cough, right? Now I want to know whether is that COVID-19. If I do RT-PCR now, RT-PCR may be negative because I had the symptoms almost like 1 month back. Then what is that I should test? I have to test for the antibodies. When will the antibodies appear? The antibodies, you take IgM antibody, it will appear by 7th day. Right? IgM antibody, it will appear by almost 7th to 10th day. And later, by almost 3rd to 6th week, right? Almost like 2nd to 6th week, there will be development of IgG antibodies. Okay. So IgM antibodies will appear in the first week. By almost 2 to 6 weeks, from 2nd week to 6th week, there will be formation of your IgG antibodies also. So once IgG antibodies have developed, then it is considered as the chronic. Then it is considered as chronic. But if IgM is positive, then it is considered as an acute phase. The individual is considered to have an acute phase. Okay. Right. Next. Now, the other important question is, so another important question by the patients who ever come to us to the OPD. Sir, there are many antibody tests available in the market. Which particular antibody test should I undergo? Then, first of all, you should know what are all the various antibody tests. First of all, you should know what are all the various antibody tests. The various antibody tests, they include the following. Right? They include the following. Rapid diagnostic test, enzyme-linked immunosorbent assay, neutralization assay, chemiluminescent immunoassay. These are the antibody tests. Rapid diagnostic tests, enzyme-linked immunosorbent assay, neutralization assay, chemiluminescent immunoassay. These are the tests for COVID-19, antibody tests for COVID-19. Now, so then which is very fast, which will give me a very quick result. The name itself is telling you, right? Rapid diagnostic test that will give you a very quick result. That will give you a very quick result. And the result can be there available to you in front of you within 10 to 30 minutes. Sir, is it efficacious? Let me tell you, the sensitivity is up to 99%. Right? Sensitivity is 99% and specificity is 100%. That is about the use of this particular rapid diagnostic test. Right? Rapid diagnostic test. And then we have another antibody test, that is ELISA. Right? Then we have neutralization assay, and then chemiluminescent immunoassay. So these are all the antibody tests. Among all those, like which is the one which will give you a very quick result? That is your rapid diagnostic test. Sensitivity 99%, specificity 100%. And within how much time you will get the result? Within 30 minutes you will get the result. 30 minutes you will get the result. Okay. Right. Now, what it will tell you? It will tell you, is there any presence of the antiviral antibodies? Right. That will tell you the presence of the antiviral antibodies. So that is about the antibody tests. Right. Now following that, yes. Now, the next important thing is the history, clinical presentation, and the symptom spectrum. Now, in this, I will not tell you the routine symptoms, right? I will not tell you routine symptoms. Now, what is this routine? Okay, before telling you the symptomatology, there was another question which was asked in the recent INI-CET exam. You had this particular question. What was the incubation period of this COVID-19? Let me tell you, again, there were many studies which are done all over the world, but there was a meta-analysis. And that particular meta-analysis have been proved that the median incubation period of the COVID-19 is your 5.1 days. Right? The median incubation period for COVID-19 is 5.1 days. Okay. So this is a very important point that you need to know now. Now, the next important thing is the clinical manifestations. I hope this everyone is aware of: headache, running nose, cough, shortness of breath, nausea or vomiting, fatigue. Now, if I tell you this, what is the new thing which I will be telling you? Nothing. Now, I will tell you some new thing. That is the presence of the extrapulmonary manifestations. Presence of extrapulmonary manifestations. Okay. So, now the question is, why there will be extrapulmonary manifestations? The organism which has entered into the lung, it will try to spread to the other organs. Right? It will try to spread to the other organs. And what is the receptor there? It is your ACE2 receptors. Right? It is your ACE2 receptors. So, through ACE2 receptors, right? Through ACE2 receptors, the organism from the respiratory system will enter all over the organs in our body. Right? The organisms from the respiratory system will enter all over the organs in our body. Now, what are those extrapulmonary manifestations? This is the new thing what you will be learning today. This is a completely a new update what I will be giving you today. Right? I don't know how many of you are aware that COVID-19 can also cause dermatological manifestations. Now, what are those dermatological manifestations that can be caused by COVID-19? Petechiae, livedo reticularis, erythematous rash, urticaria, vesicles, pernio-like lesions. These are the dermatological manifestations that can be caused by COVID-19. And let me tell you, COVID-19 can also cause cardiac manifestations, and that is in the form of Takotsubo cardiomyopathy. What is Takotsubo cardiomyopathy? It is your apical ballooning syndrome. Right? Takotsubo cardiomyopathy, it is nothing but apical ballooning syndrome. That is what is your Takotsubo cardiomyopathy. Right? Which is also called broken heart syndrome. Which is also called broken heart syndrome. Next, the other point is the Takotsubo, this COVID-19 can also affect the myocardium. And whenever there is involvement of the myocardium, there can be development of myocarditis. There can be development of myocarditis. Once the individual develops myocarditis, the individual will end up in heart failure. The individual will end up in heart failure. Okay, right? Next, the other thing is the cardiac arrhythmias. right? The other important thing is cardiac arrhythmias. There can be development of the cardiogenic shock, myocardial ischemia, and then the acute cor pulmonale. What is acute cor pulmonale? Acute cor pulmonale, it is nothing but right ventricular dilatation followed by right heart failure. Secondary to pulmonary pathology, that is called as your cor pulmonale. Okay, so these are the cardiac manifestations, and even there can be endocrine manifestation. I have a colleague of mine, right? So he is also a cardiac registrar, right? And he acquired COVID, right? From where he has acquired is a next thing, but he has acquired COVID and he got admitted into the hospital, and he had a very bad phase of the COVID. Right, he was taking remdesivir and all, but still the improvement was not adequate. But after a very long period of time, we have seen the improvement in him. And during that particular COVID infection, when we have checked the sugar levels were very high. Sugar levels were very high. And then we thought stress-induced hyperglycemia. But later, the data has shown that COVID-19 can also cause certain endocrine manifestations, and that is nothing but your hyperglycemia. That is nothing but your hyperglycemia, right? And gastrointestinal manifestations. And we had some patients got admitted with a gastroenteritis, and we tested COVID in the patient, and the COVID was positive, right? So that means the COVID-19 can present even in the form of diarrhea and as well as vomiting and abdominal pain also, similar to that of the manifestation of your gastroenteritis. And recently, we had one case of the Guillain-Barré syndrome. Recently, we have come across one case of the Guillain-Barré syndrome, classical Guillain-Barré, right? What do you mean by this classical Guillain-Barré syndrome? That means the individual was completely areflexic paralysis were there. All the four limbs were paralyzed, and it was the classical ascending type of paralysis, and reflexes were completely lost. And we tested COVID. The COVID was positive. So the neurological manifestations include the headache, dizziness, encephalopathy, Guillain-Barré syndrome. And as already I have said you, the hypercoagulability, that is thromboembolism. So thromboembolism is also very common in these patients with the COVID-19. There will be hypercoagulability. And why is that particular hypercoagulability? I will discuss in detail, right? Then followed by that, the hepatic manifestations. And these particular hepatic manifestations include elevated AST and as well as ALT. And there will be also elevated bilirubin levels as well. There will be also elevated bilirubin levels as well. Okay, so these are the hepatic manifestations what you will have, and followed by the involvement of the kidney, right? Involvement of the kidney, it is in the form of renal failure, right? Involvement of the kidney, it is in the form of renal failure. So these are the extrapulmonary manifestations what you will have in these patients with the COVID-19, right? So why you will have these extrapulmonary manifestations? Because of the presence of ACE2 receptors on multiple organs, and thereby the organism will enter into multiple organs through this particular ACE2 receptors. Okay, right. So COVID-19 can present in any of these following fashion. Then followed by that, these COVID-19 patients, they also have multiple co-infections, right? So what I want to tell you is, these patients with the COVID-19, they had co-infections with bacteria, Streptococcus pneumonia, Staphylococcus aureus, Haemophilus influenza, fungal infections like Candida and as well as Aspergillus, right? Candida and as well as Aspergillus. So the point that you should remember here is, in COVID-19, there can be also, right? There can be also co-infections as well. Right, so that is another important recent update that you have to know. Now, followed by that, how will you assess the disease severity and risk factors for severe disease? Now, patient got admitted with COVID-19 and attended during the counseling. He will ask you, sir, what is the severity of this particular disease for the patient? Right? For my patient, now how will you tell whether he is having mild, whether he is having moderate, whether he is having severe? How should I tell? Now, I will tell that patient is asymptomatic. That is when the test is positive, but there are no symptoms. Right? Test is positive, but there are no symptoms. Mild illness. What is mild illness? Right? The individual is having fever, cough, sore throat. There is no dyspnea, and there is no abnormal imaging also. That is mild illness. That means the individual is having the symptoms related to any infection, fever, cough, that's all. but no dyspnea. That is mild illness. Then when do you call moderate illness? We call moderate illness when the individual is having dyspnea, right? When the individual is having dyspnea and SpO2 is more than or equal to 94%. And there is also lower respiratory disease, which is evidenced by clinical assessment or imaging, right? Which is evidenced by clinical assessment or imaging. That is your moderate illness. Now, when do I call the patient is severe? I call the patient to be severe when the saturation is less than 94% in the room air, right? When the saturation is less than 94% in the room air. And PaO2 by FiO2 is less than 300, right? PaO2 by FiO2 is less than 300. And respiratory rate of the patient is more than 30, right? Respiratory rate of the patient is more than 30 breaths per minute. Then we use the word severe illness. And when do I use the word critical illness? I use the word critical illness when the individual has landed up in septic shock, when the individual has landed up in respiratory failure, when the individual had multi-organ dysfunction. This is when I use the word the critical illness. This is when I use the word critical illness. Okay. So this is the severity assessment according to NIH guidelines. Now the question is, there are two reasons why you have to assess the severity. Number one, to explain the prognosis to the patient and patient attenders. Number two, you will decide what treatment has to be given to the patient, right? You will decide what treatment has to be given to the patient. Okay, so for these two purposes, you need to define the severity, right? You need to define the severity, whether it is mild illness, moderate illness, severe illness, or critical illness, right? So up to here, I will just stop now, right? And in my next session of COVID-19, I will tell you what are the recent updates in the treatment, what are the vaccines, and what is the protocol that you have to follow. So until now, I have just given you an update of pathogenesis. I have given you an update of extrapulmonary manifestation. And I have given you an update of what do you mean by the word mild, moderate, severe, and critical illness. In the next session, I will discuss the new treatment protocols, and as well as I will also discuss the vaccines related to your COVID-19, right? So the next session will be today itself. Okay. So thank you very much and see you in the next session.